A couple of techniques. One, you can do it from the front. So you come in with your thumbs gloved. They don't really show there, but I would put some 4x4s on your thumbs with some tape, because when you put it back in, sometimes they'll chomp down on you. I tend to go in from behind, because then I can use a straight arm technique. This guy's arms are kind of bent, but you can step on a stool if you don't have the height. Again, it's about this. It's not about this. And so have the patient sit, and you can come in from behind and actually do the reduction. And that way you can just lean in and give constant, steady pressure. Constant, steady pressure. And if you need to, you can give them 5 of midazolam. Now, not for procedural sedation, because that's paperwork and monitoring and all that stuff. You're giving that as an antispasmodic, a muscle relaxant, 5 milligrams of Versed or midazolam to help with that. But you just want to protect your thumbs. And so get the person in a good position, maybe give them a little midazolam, talk to them, coach them about what you're going to do, pat up your finger, and then it's the steady, hard pushing. It's not a sudden motion. No relocation should be a sudden motion. It's always a steady, slow motion. All right. There is a syringe technique. This has been out for about 10 years now, and depending on how big you can either take a 5 cc or a 10 cc syringe. And you get them to bite down on it, put that in there, and then they just roll it in our teeth, and they get to control how much pressure they're putting on their mandible to pop it back in. It gives them autonomy and agency over doing it. And you can give them the syringe and walk away. It's good for patient flow, because then usually what happens is I go see someone else, and then they come and stop me in the hall, and they're holding the syringe and saying thank you because it's back in. And so you can use this 10 cc syringe bite down technique.